Pre-operative care, it is the care that we are giving prior to the surgery. The preparation we are giving for the patient before the surgery. The main purpose of the preoperative care is to prepare the patient physically, psychologically to withstand effect of anesthesia and surgery. The main principle you have to remember is different preparation is needed for different surgery. For example, neurosurgery preparation is entirely different from the preparation needed for abdominal surgery. So, different surgeries need different preparation. The surgeries mainly we are classifying as an elective surgery and emergent surgery or emergency surgery. Emergency surgery we are doing in emergency situation in case of severe bleeding or in case of the appendicitis perforation. All this condition we need emergency. Okay, emergency surgery is needed. But elective surgery means we are selecting a date for surgery and electively we are doing the surgery. And there are three ways of preoperative preparation. First one, psychological preparation. Second one, physiological preparation. Third one, physical preparation. So the main part of preoperative care is preoperative assessment. So in preoperative assessment, we have to take the history of the patient. So in the medical history, we have to assess for any comorbidities like DM, hypertension, CAD, etc. Then past and present medical history we have to check. Then previous surgeries. If the patient have a history of previous surgery, in which year, for what purpose we are doing that surgery, etc. The data should be there in our file. Then what is the current complaint? If the patient have habit of alcohol, smoking and other serious illness, then any adverse effect of anesthesia is occurred in the past surgery time, then the cooperative of the patient, then any chronic illness like cancer or immunosuppressive agent is patient using, then what is the age of the patient. All these things have to consider while doing preoperative assessment. Then the main code of assessment is A B C D E. Okay, so in A, that firstly we are assessing the allergic history. Is there any allergic to antibiotics or pain medicines, etc. Then bleeding tendency is if the patient is taking warfarin or heparin, etc. If the patient have any hemophilic disorder or bleeding disorder, etc., that we have to consider. Then C, that indicates the corticosteroid therapy. If the patient is undergoing corticosteroid therapy, means there is a chance of immunosuppression, so that may leads to complications such as infections. Okay, so that also we have to consider. Then D indicates the diabetes mellitus. Then E indicates the emboli or thrombus formation if the patient have cardiac history or MI, the previous history of MI, heart attack or the CVA. Okay, stroke history, everything we will assess in this stage. So that's regarding the assessment. After the assessment, we have to do the physical examination also. So the general physical examination findings with vital signs also we have to monitor. In preparation, the first thing is physiological preparation. So physiological preparation mainly indicates the investigation. Ensure all investigations are in normal range. Arrange the blood for patient if required. Blood is sent for cross matching. Then all investigations such as hemoglobin, blood group, TC count, erythrocyte, ECS, ESR count, blood urea nitrogen, fasting blood sugar, postprandial, bleeding time, clotting time, urine routine microscopy examination, all these things have to be done in general. Then in respiratory system, the efficacy of respiratory system functioning, we routinely taking the chest x-ray. But in case of COPD patients, we are doing the pulmonary function test and ABG also. Then in cardiovascular patient, mainly we are doing the ECG and the any history of cardiac disease, etc. Then in renal preparation, we are doing the RFT, one serum creatinine ratio we are assessing. Then if the patient have any history of cardiac problems, albumin ratio also we are checking.